Today we are discussing implicating our mobile app for our smartphones for our maternity department at Novant Thomas Health Medical Center, and basically discussing quality improvements that help lead towards the development, execution, and implementation phases of the process. To start, our healthcare facility consists of the following services. We have a list of services. Primarily, our goal is educating our maternal patients, especially ones that are coming to visit our facility for the first time. Some of our services that are included would be our educational services that guide you on maternity, parenting, childbirth classes, and breastfeeding classes. We also offer different courses that are also available on the weekend for those who may not have entered their maternity leave, still maybe within their first or second trimester, but would like to take these classes, but either due to schedule implications during the week, we do have select Saturday courses that we offer as well. Um, we provide education on how to care for our high-risk pregnancy patients, per particularly our diabetic patients. Those are the highest intake that we often see with complications when it comes to being pregnant. We provide doula verification. We have various surgical suites for our patients. We offer different types of support for treatments and birthing options, whether the woman wants to do a water birth or have a birth at home with utilizing a doula or utilizing their doula in the birthing facility. Either choice, we offer these type of services, as well as securing the safety of our infants that are in our care. Developing the mobile maternity child health care services smart app was based on our mission structure that we strive for at Novant Health, which is to improve the health of our community and to develop a structure that further increases our quality of maternal health care by also minimizing mortality rates. We also would like to be mindful that while we are focused on the quality improvements, the device is constructed so that it does align in smooth operations with anywhere that you can access internet or Wi-Fi hotspot connections. The importance of the app is, as we mentioned, monitoring our high-risk patients. We want to be able to have a early notification process before they actually enter the facility. So we designed the app based on either monitorized alerts for patients when maybe their diabetic sugar level is getting low. And the way we can determine that is the standard, pricking of the finger. And once their health records are already downloaded into our electronic system, we can then transport that data into the operational structure of the app, which will basically have each patient assigned as a high risk patient centered to get notifications to remind them when it's time for them to check their blood sugars, when it's time for them to refill their medications in advance, things of that nature. We also keep in line SMART goals. As any operation, it's definitely vital in healthcare, constructing SMART goals that not only align but also improve. So one, or actually two of our SMART goals is to improve healthy baby outcomes and improving access to prenatal care during the first trimester. And efforts of improving baby outcomes, we want to provide access to a comprehensive layout of both our clinical and non-clinical services while focusing on improving access to our prenatal care during the first trimester. We want to evolve the model through enhanced digital telehealth processes. We also keep in mind with aligning our SMART goals, how these goals and also how the app, as well as quality improvements, are aided with policies and the assistance of thereof. We have three quality improvement tools that we utilize throughout this structure, which are root cause analysis, our PDSA, which is Plan, Do, Study, Act, as well as our Six Sigma tool. We shed light more so on our root cause analysis because this is what we have to use to start. We use this to even determine what it needs to be done before we waste time and resources setting up a process that eventually does not complement our goal in the end. We then list different characteristics, pathologies, and different resources that also help outside of technology, such as the implementation of the CHIP and Medicaid Act that was constructed and designed for women who are pregnant and cannot afford health care or lack health care. In typical situations, they're usually automatically granted this service while providing the documentations, of course, for one, a positive pregnancy test and other factors. Usually they're granted this because the goal is to make sure that the baby and mother is healthy. And without the proper care and access, there's no way for us to be able to monitor the fetal growth as well as the mother's health without keeping them on a routine scheduled visit, which these standard resources such as Medicaid and CHIP has allowed us to do amongst the technology innovations that we have experienced in our healthcare facilities today. As we know, the United States has had the highest maternal mortality complications and deaths, and they actually have decreased with the innovation of technology. As we continue to incorporate these, we want to also remind ourselves that we do want to have our stakeholders be willing to agree to a budget that can be implemented so that way we can keep random updates. So that way the app is never out of date. It also eliminates bugs and any type of glitches, any type of technical issues that we experience with traditional apps. We want to have a allotted amount of funding set aside that is strictly reserved to take care of those issues, and at the same time not interfering with our budget for our medical staffing and supplies as well. We will continue to add more as we develop the end process, but this is just an overall layout of what our vision is as far as implementing this tool. And please feel free to add any additional references if you have any, and please feel free to ask any questions if there is more clarity needed.